challenging decision for patients with chronic kidney disease and their healthcare providers is whether to undergo tests and procedures such as an angiogram, an angioplasty, stent, or surgical procedure when potential signs of heart disease develop, because these procedures have unique risks to the kidney health for people with chronic kidney disease. As a result, patients with chronic kidney disease are much less likely to receive these tests and treatments for their heart, including during acute conditions such as a heart attack, where they may be life-saving.
Very much so, because basically I didn't get a chance to review any of that process until it was a few years later when I was approaching the transplant of my kidney, at which time I got called in and said, because of my heart problems, I would not be able to stay on the transplant list, which prompted me to go into the heart surgery to fix that.
We're in the process of building a tool that will help patients and care providers make better decisions. And as you can imagine, building that tool takes a lot of time and energy because the tool needs to reflect what we know about outcomes in patients with kidney disease who also have heart problems, but it needs to explain things to the patients in language they can understand so they have a better idea of what their own personal risk may be.
This particular project is huge, right? Because patients with kidney disease have a lot of heart disease. They often need procedures. However, there's always the risk that the procedure will lead to kidney failure or dialysis or a worsening of their kidney disease.
That having a decision aid and having a tool to work through can, perhaps ensure that certain key questions aren't missed, or maybe certain considerations that may not otherwise arise can be brought to light and discussed. And so it's really maybe a bit of a roadmap, for lack of a better term.
It gave me the strength to ask the questions I needed to encourage conversation about it. Just don't say, well, you have this, and this on the test, and we're going to put you on this med.
These are your heart. And I said, well, you realize, doctor, that from the last episode that the dye was what constituted damage to my kidneys. He said, well, we got a little bit of an issue here.
Either or.
And
your decision.
It was my decision.
My work is, that if they do get the more invasive treatment, actually overall they tend to do better in the long run. And I think this updated work actually puts some hard numbers behind that and identifies actually some groups within that broader kidney disease groups, some really high risk groups where you have to be very, very careful, and a much larger group of people where you can really treat them primarily as if they are any other patient. And that is actually, I think, going to be a big benefit to the clinician community, recognizing that not everyone with kidney disease is the same.
Summarizes how this project makes me feel. I would say optimistic.
Confident.
Useful.
Hopeful.
Like we're doing something to improve the experience for the patient.
I guess I'm happy that it was done.
Word is awesome.
Join us on the clinical decision support journey, and let's improve healthcare for all.
Very excited for the future when we can bring all of this information and knowledge together into a decision aid. I think this will be a very powerful way to translate a lot of knowledge into clinical practice.